Estás viendo Canal América, televisión dominicana para el mundo.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your fears.
Welcome back to A Time for Truth show. I'm your host, Dr. Bernardfialkoff, and it's a pleasure to have you with us again today. And we're going to be going into something that's very important, our smile. The confidence that we have when we're with others, the ability to also to eat and enjoy, dinners with others and be comfortable while we're in their company, that dentures are not going to fall out or we don't have spaces in our mouths where the food is accumulating. So today, I'm going to be presenting to you myself as a 40-year periodontal and dental implant surgeon. I had trained at the University of Tennessee Dental School and the Memphis Veterans Administration Hospital in my specialty of periodontics, implantology, and laser surgery. We have a practice in Bayside, New York now for over 40 years on 56th Avenue and 214th Streets, serving our metro New York area. And so let's get right to it, and we'll put the presentation up on the screen so you can learn how you can regain your smile and your confidence. And Buddha, if you put them up, there we go. And we will begin with our presentation. And there you have our phone number, our email in case you need to contact us. And 718-229-3838. Let's get on to this talk about regaining confidence and regaining our smiles. If I showed you this and you were to look, you'd say, well, this person has all her teeth and she's perfectly fine. There's nothing wrong. But what you would never realize is that she has 2 dental implants. And if I were to ask you where they are and you were to look, you probably would have great difficulty in knowing. So I will tell you that those are her lateral incisors on the upper jaw, and those are implants. And those are the crowns made by her general dentist, who did a fantastic job over the implants that we placed. No one wants to go around with dentures, with teeth that are loose, with plastic in your palate because they're taste buds on the palate. What happens when you put something artificial to hold plastic teeth? You lose the sensation of taste and of heat. You can burn yourself because you're not aware of the heat. What's called proprioception, the nerves in the area, are very important for sensations. And we're missing that when we have these plastic teeth, aside from the fact that taking them out at nighttime with your special person around you, your partner, is not really a fun thing to do. So let's go on to the next slide. And here, again, we have a result of implants. This happened to be a young girl, about 20 years of age. And again, she was ecstatic at the result that she achieved. We placed her implant, and her general dentist placed her crown. You see how her gum regrew and contoured around the implant. And I would have to tell you that it's the upper left lateral incisor. And you can see how happy she is and comfortable in her facial smile. Here we go. Now, This is a very common problem that we get in the dental office routinely, a fractured tooth because of too much decay or biting on something very hard like a walnut or inadvertently hitting something in a Cheerios box that has something hard in it that you didn't anticipate, and you crack a tooth. Well, in today's world, it's not the end of the world. Why? We can take that tooth out and the same day replace it with a dental implant root that allows you to have your own tooth again. And if you take a look there, you see the before on the left and the after on the right, and you say, well, it's impossible. How does a person have more gum when they've lost their natural tooth and they placed an implant and they had an extraction? Well, with the techniques that we utilize nowadays, it is possible, and that's a result that you would obtain. Many, many patients come in and tell me, you know, Dr. Fialkoff, I have this spot over here, I'm very sensitive. Or when I smile, I notice that the gum is very high on that tooth. I'm not happy with the way that looks. Or, you know, I brushed too hard a few years ago and my gums have receded and I don't know what to do. Or I had braces, but the gum never corrected itself. And so there is something that can be done. And here you actually see one of my colleagues' daughters, and he sent her to our office, and we did something called soft tissue grafting, or what people call gum grafting. We took a little bit of her gum, which grew right back, and we placed it over the area that was deficient that you see on the left. And then you see the result about 3 months later on the right. You can see how we increased her gum tissue so she won't have recession again. And you see how we've covered the root surface, and so a very small amount that wasn't covered. She was very, very happy, and this is the result you can expect. If we go on to the next slide, you'll see another case. This woman had orthodontics and unfortunately had tremendous recession on this incisor tooth. She was distraught. When I first looked at her, I explained to her, I said, I don't know. I think we're going to, unfortunately, have to remove the tooth, graft the bone, and then come back and do a dental implant for you. And she begged me to try and do a soft tissue augmentation procedure, a gum graft procedure. I explained to her, as long as you don't hold me to it, I will try the best that I can. So we did that at the office under local anesthesia. And you see the result that she obtained 2 months later. And that's actually her. Many times when I show this, people say it's impossible. The before must be at the bottom and the after must be on the top. But no, that's the result we actually achieved. She was ecstatic. Her orthodontist was ecstatic. And I was very happy and pleased that we didn't have to remove her tooth. We didn't have to extract it, do an implant. And we saved her tremendous anxiety and cost and travail. Next slide. So what is a dental implant? So there you go. A dental implant is what you see there. It's basically a titanium screw. Why titanium? Because titanium adheres very well to the bone. And there's no infection, there's no adverse reaction. And it's been in use for over 40 years now. They were developed in Sweden by Dr. Bernardfialkoff. And here you see a diagram of the implant and how the tooth emerges from that implant. Here you have the different types of teeth, or what we call crowns, porcelain crowns, that can be placed over the implant. One type on the left is cemented. One type on the right is retained by a little screw that goes into the center of the crown, which both of these are done by your general dentist. I work with your dentist, and what I place is the implant that you see on the bottom of that slide, and then the dentist will determine which type of crown will best suit your needs. Next slide. This is the original letter when I first started training in implants, and I trained with Dr. Bernardfialkoff in 1988 in Boston at one of the original lectures along with my buddy, Dr. Stephen Wallace, who found this letter of the both of us on this stationery, and it was amazing to look back of how many years it's been now. Next slide, please. Here you have the three-dimensional scan machine we utilize at our office, and it gives us anatomic views of the bone. Why is this? Next slide, Buddha. This is because we can plan. Here you can see that we can see the bone in cross sections. So we know before we ever do the procedure exactly what we want to do, what implant we want to do, what type of procedure we want to do, is it safe? And knock on wood, in my office, we've had no one ever with any kind of numbness or adverse reaction. We're very careful to follow strict protocols. One of them is a 3D CAT scan. And there you see the implant on the lower right, placed according to what the CAT scan showed was feasible. Next slide. And then here you see he's very happy. The result that you see, how the gum grew around the implant. So we have a nice result. And you can see when he smiles, you have no idea that he ever even has a dental implant. Next slide. Now, is it always better to go cheap or inexpensive or save time? No, not always. Here's an example of one of what I would call a weekend warrior. Someone who over a few weekends took some courses, bought little tiny implants. Why tiny implants? Because probably they did not utilize a scan, were afraid with what they were doing, shouldn't have been doing it, place small implants. You can see how the implants look like little toothpicks. One of them crosses through one of the roots on the upper jaw. The other two on the bottom are much too small. And this person came to me with a lot of problems that I had to correct, which would have never happened if that person didn't seek fast treatment and inexpensive treatment. It's too much of a truism in life that you get what you pay for. Next slide. And here you see how we plan with the CAT scan that we have in the office. Those that you see there are not implants, those are facsimiles or made-up images with different sizes, different diameters, different lengths. And you can see how we plan before we ever even do anything. So between myself and your dentist, everything is totally coordinated before we even start off so that you know exactly what you're going to have done. Next slide. Here you see on the top left, very narrow bone. We know this because of the CAT scan, because visually you can't tell. So if a dentist were trying to tell visually, he would make a lot of mistakes. But with the CAT scan, we can see that the bone is very narrow. And we do something called bone grafting. There you see on the lower right, the result of that bone grafting. You can see how the bone thickened, and now this person can have implants. This because we diagnosed it correctly with a three-dimensional scan. Next slide, Buddha. Now, here's a case on the upper left. You see the person is missing a tooth, but their sinus is very large and they don't have much bone. But in the office, what we do is a one-day procedure with local Novocaine, where we actually make a little opening into the bone and we start putting in bone into the sinus area. You can see that in the middle picture. And you can see how we make a dome of bone that the implant is then going to go into in the middle slide. And then you see a few years later how that bone actually matures, how the dentist makes the tooth on that implant. And this person now has been about 9 years and has that implant in his mouth. This is Victor. Next slide. Here's another example, because you're probably out there to say, well, but I lost all my tooth, Dr. Fialkoff, and my doctor told me my sinuses are too large. Well, it's no longer true, because in dentistry, we have an ability to grow bone, and the bone can be grown in areas of deficient bone anatomy. And there you see it, the upper right, the person had very severe gum disease, lost their teeth. On the next slide to the right. And there you see on the bottom how we grew the bone back with a sinus graft, how we put the 3 implants, and how the dentist then made a bridge on those implants. And he's been functioning this way now for over 20 years. Next slide. Another case, another person missing their upper teeth was told that the sinuses were too large, they could not have implants, came to me for another opinion. We did sinus grafting the same day as we put the implants, the same technique as you saw before. And there you see how we domed up the bone and had the bone receptor site that the implants would go into. And there you see on the lower right, the result now 4 or 5 years later. You can see how the bone has matured, and you can see how she has those 2 implants. She's very, very happy and has been having a great experience. When she comes back to see us, she's always happy. Here is another patient, another woman, and she unfortunately had very severe gum disease. She had gotten different opinions at different offices, came to us, and we explained to her that we could take out the very badly involved teeth. You can see the black areas around the teeth. That's the bone that's missing. And you can see in the middle how we took out those bad teeth that had severe periodontal problems. We grafted it with bone. And you can see how there's an increase in the gray-white matter. That's the bone. That's how bone shows up on an x-ray. Grayish white, the more dense. And when you have darkness, you have missing bone. So you can see she had a lot of missing bone. And then you see how we grafted the bone. And then on the bottom slide, you see her implants. You see how the bone is now healthy. And you see the beautiful bridge that dentist delivered to that very happy lady. She's had this over 20 years, came back recently, fractured a tooth, and needed one of the implants I told you immediately. She had that done, and she soon will have that tooth back again. Here's a case of a man with severe gum disease. You can see the darkness in the bottom, on the top. He had to lose a number of teeth. We used the CAT scan to diagnose him, did an exam. Here you see the facsimiles of the implants. You can see how we healed the bone. You see all that white gray area, that's the bone healed. You see how we plan out the case with the general dentist. He's going to have 5 implants. We go to the next slide. Here you see the implants in place and nice healthy bone. Next slide. And here he is smiling. And you know, here he's a middle-aged guy. He didn't want to have super white teeth. This is what he wanted. He wanted to look natural. He wanted to look like himself. He eats very well. He has no plastic in his mouth. He's happy as can be. Next slide. Here you have another case. This is a man who you see there with a denture. He didn't like his denture. He wanted something different. He also had gum disease, and he didn't know what to do. He was distraught. Go to the next slide. So we took out the bad teeth. We grafted the bone. You can see the implants that we placed. You can see how the bone is healthy. And on the upper picture is what I always love, the smile. You can see how ecstatic he is. He doesn't have a denture in his mouth. He doesn't have a piece of plastic in his mouth anymore. He has his own teeth. And implants are just like your own teeth. You don't even know you have them. Just like right now, no one knows or aware of their teeth. And he's confident, happy man. Next slide. Sometimes you have to do orthodontics because the teeth have shifted. So as a periodontal implant surgeon, I work with the orthodontist and the general dentist, or the prosthodontist, which is a specialist of crown and bridge. And together, we formulate a plan. This plan was to first move the teeth, create the proper spacing that's going to give the proper spacing for the implant and the cosmetics. There you see the implants in place on the bottom, orthodontics at the top. You see how we shifted the teeth. And here you see her result. She was ecstatic. All the dentists were very happy, as I was. Success and a happy patient. You may say, oh, Dr. Fialkoff, I had an implant. I wish I had gone to see you. And you have a picture like you see here on the upper left. All that darkness around the implant. Your implant is failing. and you go, why didn't I get this done properly at first? Or you had it done properly and maybe your diabetes went out of control. Or maybe you had some kind of situation during COVID. You got sick, and unfortunately, medical problems, diabetes, high blood pressure medications can impact on the gums and create gum disease, which is called periodontal disease. So this person came to me, was an elderly person, was distraught. She was concerned medically. We treat medically compromised patients. We consult with a physician. Physician said, okay. We treated her. We took out the failed implant. You see the bone graft in place on the right side in the middle. You can see how the bone is grafted. You see on the bottom left the implant in solid bone. And there at the bottom right, you see the miracle. The bone regenerated, the implant in place, and the crown in place, and a happy person who can eat again and have confidence. Here again, here's the person that you saw originally. She had the severe recession. So if you're sitting out there and you've thought it's impossible, what am I going to do? I'm distraught. Give us a call and we will take a look. And many times we can do a soft tissue graft result like you see here on the screen. Or if it's impossible, we can do it with an implant. The main thing is to get your confidence back, get your smile back, get your ability to function, and not to leave a tooth like this in place, which is going to end up harming the adjacent teeth, because periodontal disease or gum disease spreads if it's untreated. This I always love because I love being with my patients. You know, you get a very personal interaction. Being a dentist, you're very close in with our patient, and there's a lot of fear and apprehension that we have to take care of first. We're getting good rapport. I like to find out, you know, what is it that you need? Why did you come to the office? What is it that you're worried about, or what's bothering you? We address those needs so that you walk out a happy person. And you see that there's different logos on the bottom right. That's my affiliation with my specialty of the American Academy of Periodontology, the Pierre Fouchard Academy. I'm a member of the International College of Dentists, and with the American Laser Society. And my specialty is called periodontics, gum disease, implantology, giving support back so we can have our teeth back when they're lost. Next slide. And that's our purpose in the office, to provide our patients with confidence, with happy smiles, because, you know, life can really be difficult. And it's much worse when you're uncomfortable, when you can't chew properly, when you're a group of people and your dentures are sliding around. And I didn't show that, but if you have dentures, we still can get you so you have teeth, and more simply or more economically, we can place 2 implants to hold the denture in. So your denture is not clicking and falling out on you, and you can be comfortable, because the whole idea is to make you function properly, comfortable, eat properly. One of the things that happens is if you don't eat properly, you tend to eat sugary foods, soft foods. You avoid foods that are good for you. But one of the beauties of dental implants is you can regain your ability to eat well, to be comfortable, to eat a nutritious diet, to maintain your health, because gum disease, heart disease is actually correlated in a triad with gum disease, with tooth loss, and it obviously follows. So we need to preserve our health, and preserving our oral health is very important, because that's going to lead to preserving our overall ability to have a happy, healthy life, to smile, to be confident. And it's been a pleasure presenting to you today on dental implants, on gum grafting. Together with your dentist, we can definitely help you and to regain what you thought maybe was impossible. So from a Time for Truth show and from my office, I'm Dr. Bernard Fialkoff. I hope this has been helpful. Brush once a day, at least. Twice a day is much better. Floss definitely at night. And see your dentist every 3 months for a cleaning, even if the insurance doesn't cover it, so you can avoid having to have dental implants. But if you need dental implants, by Jove, go get them. Be happy. Get your smile back. Thank you for tuning in. We'll see you again on our next episode of our Time for Truth show. Be well.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your feet